one here with that. What do we call these? Are medical equipment, and knowing how to use your medical equipment properly. I work with a hypertension clinic that works out in West Philly every Monday night, and it is amazing when we're going out and we're teaching people how to use their asthma inhalers, how many people don't know how to use them properly and are going through a puffer every 2 weeks because of the fact that they're swallowing the medication. It's not being used rather than inhaling it. So there are techniques that are involved with these things. If you're diabetic and you're using a glucometer, making sure you know how to use that appropriately so that, number one, you're getting an accurate reading. And sometimes these accurate readings, the glucometers, you need to change the chips in them when you change your strips because of the fact that you're going to get a misreading, and they're either going to be much higher or much lower. So knowing how to take care of your equipment and knowing how to use it is really important. And one of the big things from both the medical and a pharmaceutical profession is that we're great at saying, here, use this and take it twice a day, and giving no instructions for it. If you're not really sure, please ask the pharmacist, the nurse, or the physician what the appropriate way of taking or utilizing that medical device is. Injectable equipment is the same way. For those of you who are on any type of injection, if you're on insulin, where is the best place to inject your insulin? Do you need to rotate your sites? If you're on heparin or Lovenox or something on that sort as an anticoagulation med, is it better in the arm or is it better in the fatty deposits around your waist and your midline? Get to know those types of things. Anyone here on eye drops? So we've got people who are on eye drops right now, which we will see with retinopathies and glaucoma and a number of other things. What are the appropriate ways of actually utilizing those eye drops? You know, is taking the bottle and just kind of dropping it in like this? Is it, you know, actually touching the eye, which you can now spread infections if you have one, not only with yourself, but you can just keep reinfecting the eye each time that you touch it. So there are proper techniques in ways of being able to administer eye drops so that you're not spreading these inflammatory conditions or infections or reseeding them in your own body. Next slide, please. Okay, medication storage is always a big concern and a big problem. Basically, from an FDA standpoint and a pharmacy, when we're storing our medications, we are required by law to make sure that meds are stored at a certain temperature. If they come in above that temperature or below that temperature, we have to discard them. And it's the same thing from a storage standpoint as well. So basically what we're going to tell you as a consumer is keep it at room temperature, avoid excessive heat, avoid excessive light. So excessive heat is don't put it on that counter right next to the radiator. Don't put it on top of the refrigerator. If you're looking at drugs which actually, what we call deliquescent, which will actually dissolve very rapidly, such as nitroglycerin, you want to keep it out of a place where there's moisture as well. You want to keep these dry. You want to keep them in places where they're going to be safe, but you're going to be able to access them. Also, for those of you who, let's say, a lot of times go on antibiotics, especially antibiotics which are liquid formulation, and I don't know how many of you have children here who have had to be on some sort of suspension or a drug. Many of these drugs actually have to be refrigerated. If they do have to be refrigerated, many times these drugs have an expiration date. So the expiration date is usually at someplace between 7 days and 2 weeks for most medications if they are refrigerated. What I want to tell you here is this, is that if you don't keep these drugs longer than what their shelf life is, most prescriptions now that are coming out will say this drug expires by this point in time. So make sure that you're utilizing that date on it. Don't save it for another rainy day or another type of case when you're getting an infection. And again, avoid high humidity because most of these drugs, remember now, are designed to dissolve in aqueous solution. So if you get moisture in the air, these drugs are going to start breaking down and they may lose some of their potency because of that breaking down process because of the exposure to moisture. Next slide, please. Special preparations. Many people have what I would call achalasia. This is a difficulty in swallowing. So rather than taking huge horse pills, they want to cut everything up. Before you do this, consult your pharmacist, consult your physician or your nurse to see whether these drugs can be crushed, whether they can be broken in half, whether you can alter however you're going to be giving them. So if you're in a capsule formulation, you're getting a capsule, don't just assume you can take that capsule, open it up, put it in some water and drinking it, because the capsule may be physically designed to dissolve in your intestines rather than in your stomach. So if you're giving it that way and you put it into the stomach, then all of a sudden you've lost the effectiveness and potency of it. If you're taking a product, especially let's say some of your hypertension medications, which are given once a day, and you have extended release, XL, XR, extended release, anything along that side, say it's taking once a day, many times these products cannot be crushed, because what you're doing is instead of giving that drug a 24-hour life expectancy in your body, you're now giving it 5 to 6. So especially if you're taking blood pressure medication, you may be getting much more at the end, or much more at the beginning than you are at the end if you are crushing or opening up these tablets. So just make sure that if you do something like that, that you've gotten the okay, or you've talked with a physician or a pharmacist about it. If you're doing split tablets, now I know a lot of times also because of money and the whole bit, if you only need to take 5 milligrams of a drug and you can get a 10 milligram tablet and you can split it, you've now got twice the amount of doses for the same price, and that's fine. But just make sure that those tablets are splittable. The other thing that I would do is recommend is that you can go to any pharmacy, you can actually go to dollar stores now, and get a tablet splitter. You know, we don't want you going into your kitchen pantry and getting a knife and trying to saw something in half or using a razor blade or whatever. Use something which is actually going to be a little bit clean, a little bit sterile, and then actually take it that way. If the tablets are not splittable, in other words, if they're not scored, really consider getting a liquid formulation or something where you can take a less of a dose, because otherwise you're either going to be getting more or getting less. And a lot of these tablets are not made to split, so all of a sudden you try to split something, it just crushes and you've lost a lot of the product right there. Next slide, please. Okay, now as Dr. Stern was saying before, a lot of drugs have a lot of side effects. Now there's a difference between a side effect of a medication and an allergy to a medication. From a pharmaceutical standpoint or from a pharmacy standpoint, we consider a person has an allergy to a medication. If they turn red, throat starts tightening up, they can't breathe, things along that line, you may not, or they go welts and hives all over the bodies. Those are true allergies. Side effects are the things that you would normally see are expected within the literature of a medication. So for a lot of medications, you may get a rash. That's a side effect of a medication. It's not a true allergy at that point. Viagra, you know, if everyone sees that right now and you hear all the side effects of it, you know, if your vision turns purple, you lose vision, it's not an allergy at that point, it is a side effect of those drugs. So whenever you go to a pharmacy, you're getting a new medication, there is what they call a PPI, or patient package insert. Request that, it's a printed piece of information. The big thing that you want to do here, though, is sit down and read it carefully. And do we have any hypochondriacs in here right now? So we have a couple of hypochondriacs, and that's one of the big things you want to be very careful of when you go online and take a look at these drugs, because the FDA requires in our pharmacy package inserts, if this patient has ever had swollen gums, if this drug has ever caused a single death, if this drug has ever caused a rash, it is required to be reported. So, but if you take a look at most of these products, a lot of the information that goes out there was saying less than 1%, less than 2%, less than 10%. So kind of keep that in mind. Not every drug is going to have a side effect. Aspirin has caused death, but I can almost guarantee you everyone in here has taken aspirin and lived through it.
What is the difference between allergy to medication and an adverse effect? Because I have adverse effect to ibuprofen because of a medical condition, but I don't understand, like, I usually tell them I'm allergic to it. And when I went to the doctor, they said it wasn't an allergy, it was an adverse effect.
Right, usually what we would talk about as an adverse effect is something you can either work through in taking the drug or that it's not life-threatening. And a true allergy is something which would be life-threatening where you could really hurt yourself taking that drug. So let's say a bee sting. You know, there are people who can get bee stings and they just get a little well. There are other people who it actually becomes, that venom becomes toxic. They can't breathe. It's anaphylaxis. They start dying. There are other people who will take a medication and they will get a rash over their entire body to the point that it's welts, it's oozing. those are the type of things we would call allergies. You don't want to take them.